Well, look at these lashes, and they are not fake, they're real. Plastic surgeon Dr. Douglas Grace of the Grace Clinic in Burlington is here, along with Stacey, whose beautiful lashes those are, with details of a new way of thickening them. And you might have seen the magazine's ads, actually, or the TV ads in the States. Brooke Shields is doing the advertising work for this chemical. It's called Latisse. Yes. It's a medication, and it was actually a byproduct of glaucoma medication.
Yes, it's the same medication that's used for glaucoma.
Right.
But it's only 5% of the actual intraocular dose. And because of what they were learning is that when people were using this for the glaucoma, their eyelashes were thickening, lengthening, and darkening.
Right. And you said to the point where they had to cut them.
They were actually having to cut them for they were rubbing on people's glasses.
Wow.
So what they've done now, which is great, is this is just 5% of the same concentration, and it's just applied topically to the upper eyelashes.
Okay. And you have to go to a plastic surgeon or a cosmetic surgeon
Correct.
in order to get it, right?
Yes.
But you don't have to be referred to your doctor?
No, you can just call up your plastic surgeon, dermatologist, someone who does a lot of cosmetic medicine, and then you can get a prescription. It's a prescription-grade medication.
Okay.
And you apply it for about 2 months at night, just one little drop, and you'll start to see the nice thickening, lengthening, and darkening of your eyelashes.
Great. So, Stacey, how long was it before you really started noticing that? Because I still can't. I look in your eyes and I'm like, okay, I cannot believe those are real eyelashes.
It took about a month before I really noticed the thickening of them.
Really? Right. So do you have to, I mean, you've got mascara on now because we're on TV, but do you find that you have to wear it at all, or?
No, I really don't have to. It's really grown them, the length of them, and it's really thickened them.
Okay.
So.
Okay. We've got some before and after pictures, actually, and one of them is of you. I'm not sure. We're going to call them up now. Is that you?
That is.
That is you. Okay. So that's a before and after then, and Dr. Grace, you were saying that what is it? 20% of the cosmetic makeup industry
is for
eyelashes
medication or mascara alone. So. It's a $4 billion business, and 20% of that's being spent to enhance your eyelashes, and this is a way that you can actually enhance your eyelashes naturally.
Okay, okay, and you're going to show us how it's done.
So we just put a little drop on the eyelash applicator, and then we just bring it right along the upper eyelashes, and then dab any little extra that we have off on the upper lash.
Okay, and you don't use it on the lower because it's not studied for the lower?
Yeah, the clinical trials have been just on the upper eyelashes.
Okay, and any irritation or burning or anything like that?
Nothing.
No. Now, do you wear contacts?
I don't.
You don't? Okay, see, I wear contacts, and I'm kind of wondering what would happen if you put that on. And
yeah, so in the clinical trials, they've shown that you should take your contacts out before you put it in, and then you leave it out. Leave your contacts out for about 15 minutes. Reason for that is that some of the preservatives can just be taken up by your contact lens and cause a little bit of irritation.
Okay, okay. And what about the cost?
The cost is $150 for 2 months. And then when you want to renew it after your 2 months, you can use it every day or every 2 days. It just depends on how each person's growth is.
Okay. You haven't had to cut your eyelashes or anything? No, it's not quite that strong there. So what kind of response are you getting then from clients coming in? Do you have any men coming in for this?
No, we haven't had any men that have come in for it yet, but we see a lot of people when they start to lose their eyelashes, either with age, they find that it really helps them to thicken up their eyelashes and gives them a nice natural long look to their eyelashes.
Okay, and are there lots of doctors using this in Canada?
Yeah, it's you have to be usually a plastic surgeon or dermatologist.
Yeah.
And you need to do a large fair amount of cosmetic surgery or medicine, and those are generally you want to go to someone that's experienced and that has a lot of experience with using the medication.
Anybody who shouldn't use this?
Anyone that's had glaucoma and has had issues with the Lumigan, which is the same type of medication, that's really the only contraindication for using it.
Okay, so you could use it when you're pregnant.
Well, with pregnancy or breastfeeding, it hasn't been studied in clinical trials, so we recommend not to use it because we don't really know. So it's always better to be safe than sorry when you have a baby. Okay, great. So more information is actually on your website, drgrace.ca? Yeah, drgrace.ca. Okay. Dr. Grace and Stacey, thanks so much for coming in. Give us another bat there of your eyelashes. There we go.